All right, I'm going to continue with our case study involving Mr. Warner. We did talk about the way which we should continue to assess his pain level, particularly if he's doing a lot of coughing, and definitely monitor his hydration status, especially if he continues to have a fever. That will put him at a risk for becoming dehydrated. Make sure he's drinking fluids. Not sure at this point if his IV fluids are running, but definitely to monitor his output as well, and to kind of assess the characteristics of his urine. If it's very dark yellow, that does indicate that the patient is somewhat dehydrated. Looking at his pulse ox, which is usually standard assessments, usually done by the PCNA when they're doing the patient's vital signs and temperature and heart rate and respirations. And looking at arterial blood gases, we're going to talk more about those in week 4 with oxygenation. And then again, looking for signs of respiratory compromise, looking at his respiratory rate, listening to his lungs, just to be sure that he is adequately oxygenated. Look at his capillary refill, and really making sure that the patient is doing some good pulmonary hygiene as well, to hopefully clear out those secretions. All right, let's look at question number 3. Mr. Warner will be in the hospital for several more days. What can you do to prevent feelings of isolation and boredom? Especially when the patient starts to feel better, they do become a little bit bored and a little bit antsy. We would definitely hope that family and friends were coming in to visit, but not continuously, so the patient does have adequate amounts of rest. But definitely his wife, children, or even his spiritual leaders, such as a priest, rabbi, minister, whatever. But they should be limited to people that are healthy. We don't want him being exposed or being around somebody that could compromise his health, because remember, he is immunocompromised, meaning that his white blood cell counts are low, and putting him more at risk for getting another infection as well. You could also encourage Mr. Warner to visit with people on the phone if he has the energy. And I think as nurses, we need to kind of determine that the patient isn't doing too much. You could also help him to avoid boredom by encouraging him to watch TV. He could read or participate in other quiet activities he enjoys. Families could bring him in some crossword puzzles or books just to keep his mind active. You could also provide activities that the hospital has, or you could also encourage his family to bring in activities from home, such as his favorite books, or even magazines, or even movies, or word games. And there's a lot that people can do on their phones as well. You can watch movies from your phone or television shows as well. The next question, question 4, is why did the physician not prescribe a cough suppressant? And that is a great question. The reason we don't want to provide him or administer a cough suppressant to him is the fact is he needs to cough to remove the sputum from his lungs, and this will make it easier for him to breathe, and it is a natural part of the immune response to help clear the infection from his lungs. So that's why you wouldn't see him be prescribed a cough suppressant. All right, what effect does Mr. Warner's immunocompromised state have on his level of care? Well, it has a lot to do with his level of care, because if he's in isolation, we want to make sure that all precautions are being used and that everybody is completely adhering to what PPE has to be worn when entering into this patient's room to avoid spreading any type of infection to him, or the chance of him acquiring a nosocomial infection. So as the RN, you are responsible to be sure that everybody who enters Mr. Warner's room should be wearing the appropriate PPE. So what nursing interventions can reduce the risk of infection spreading to his blood? We don't want this patient to get septic. Let me scroll that up so you can see that question. Oh, sorry, I scrolled up too much. I'm going to scroll up here so you can see the question. All right, sorry about that. All right. Well, he has pneumonia, which is definitely an infection and trauma to his lungs. And one of the complications from pneumonia is septicemia or sepsis. Therefore, a nurse does need to carefully monitor the patient's, the client's sputum for any blood or any type of systemic infection. And if the client's condition worsens, the nurse should notify the physician immediately. The nurse can decrease the risk of systemic infection by administering antibiotics as prescribed and teaching the patient how to expel sputum gently to prevent trauma. Good pulmonary hygiene, and using a aseptic technique when inserting, removing, or assessing the IV lines. Nurses should also carefully follow infection control procedures before and after working with the patient to prevent the spread of infection. And, keeping an eye on his temperature. You may not see a real big spike, but any change that would indicate an elevation of his temperature could indicate that he is getting another superimposed infection. As I said, they may have done blood cultures earlier, but maybe they might want to do them again just to make sure that the patient has not developed any type of sepsis, because this infection seems to be very serious. Because let's go back to that original question that I had asked you earlier about why did he have blood in his sputum. There's a lot of irritation to the pulmonary tissues, and that's what's causing the blood, because blood in the sputum can account for many reasons, but for this particular reason, or for this particular patient, it was the fact that he had this streptococci infection in his lungs, which is very irritating and abrasive to the lung tissues, and that's where that bloody sputum came from. So just really monitoring this patient, because he should be getting better if he's responding well to those 2 antibiotics that he's on. All right, so let's continue with this case study as well. Go up here to the top of the question. Sorry, I'm trying to get it on the screen here for you so you can see the questions. All right, let me get it in the screen for you. There it is. Okay. After 1 week in the hospital, Mr. Werner is finally going home. His vital signs have stabilized. He is no longer coughing up sputum, and his rales are barely audible. He was able to continue his chemotherapy treatments in the hospital, and now he has only 1 treatment left. He still feels fatigue from the chemotherapy, but the fatigue is not as severe as during the acute infection. You are providing discharge teaching for Mr. Werner. So what client teaching can you perform to help decrease Mr. Werner's risk of infection while he's still immunocompromised? And this is such a great question, because he really does need some very, very good teaching to prevent him from returning back to the hospital with a flare-up of his pneumonia or, unfortunately, acquiring another type of infection. I would really recommend that he don't go out into public places for a while, and I'm sure he still has to get his energy level up as well. And I think the basics behind the basic information to definitely get through to the patient and to their families is good hand washing techniques, just like we're doing now. If he was going to a public location, which would definitely increase his risk of infection, I would recommend that he wear a mask to prevent inhaling any type of pathogens. Of course, good hand hygiene, especially after using the bathroom or coming in contact with something or someone that may be contaminated. He should also not share any eating utensils or hygiene items with others, especially if they've been sick recently. You should also teach him about looking for signs and symptoms of infection, such as maybe taking his temp for every day or a couple times a day for at least a week, and apply antibiotic ointment to all wounds to prevent infection that may spread to his blood. And Mr. Warner should also consume a healthy diet with adequate nutrition and fluids, and make sure that he's getting adequate rest to build his energy reserves, again, for fighting off new infections. And the good thing is he's only got one chemotherapy treatment left, so at this point I'm happy to say that after that one is completed, we hope to see his white blood cell count start going up. They'll probably do follow-up on his tumor in the colon to make sure that his colon cancer is gone as well. And I'm sure we would encourage him to continue with follow-up appointments to his physician if he needs further labs or any further x-rays or diagnostic testing. All right, so question 2, the physician has prescribed an additional regimen of oral antibiotics. What should you emphasize about the importance of completing the therapeutic regimen? The nurse should emphasize that even if he feels better, Mr. Warner should complete the antibiotic regimen to help prevent the development of bacterial resistance and help reduce the risk of recurrent infections. And that's very important because a lot of people do start to feel better and then they don't complete the whole full 7 or 10 days or 2 weeks or whatever's been prescribed for the patient. What warning signs should Mr. Warner be watching for that may indicate another infection? Again, teaching him about the warning signs of infection. If he develops another fever, if he develops sweating and chills, nasal congestion, sputum production, coughing, pain, even urinary problems, loss of appetite, nausea and vomiting, or development of a pus in a wound. So the other question here is, to what other opportunist infections may Mr. Warner be susceptible to, unfortunately, be acquiring? And obviously one big one is a urinary tract infection or bacterial or another bout of viral pneumonia. Common infecting organisms include E. coli, Enterococcus, P. aeruginosa, and Staph aureus. So those are things that we want to hopefully keep away from the patient so he doesn't get sick again. And then question 5. What nutritional requirements does Mr. Warner have now that he's going home? Good balanced nutrition, maybe gradually getting his amount of calories increased, better protein, good fluid intake. We want adequate protein to support tissue repair, and it also helps to strengthen the immune response as well. And if we were looking at nursing diagnoses in regards to Mr. Warner, think about what they would be. And some of the things that I had come up with is readiness for enhanced self-health management, risk for deficient fluid volume, fatigue, risk for activity intolerance, and definitely risk for infection. So this is, I think, a great evolving case study. It really kind of lets us see how the patient looked when he came in and exactly what we were going to do. And don't forget too, because the patient is on these IV antibiotics, it could also put him at risk of developing C. diff. And I'm going to talk about that in just a few minutes and bring up a PowerPoint and talk about C. diff, because we see this a lot with our patients. And we'll look at who is at risk for developing C. diff, but this patient definitely is, because he does have a lot of the risk factors. So please go over this again and see if you had any additional answers to what I provided you. But I think it really gives a lot of great information and how we can develop a plan of care and then implement that care to this patient to hopefully get him home, which is what happened, which we're very happy to say. So that's our case study with Mr. Warner. All right, so let's talk about C. diff. It's our exemplar for our concept of immunity, all right? If we kind of examine our GI tract, we see over 1,000 species of microbes in the GI tract, and C. difficile is one of them. Most of them are harmless, but unfortunately sometimes we see an upset in the balance of these microbes. This is when C. diff grows out of control, toxins are produced, and this causes extreme inflammation and diarrhea for the person and the individual. So what do we see when a patient develops C. diff? Great question. What we see is the symptoms include watery diarrhea up to 15 times each day, severe abdominal pain, loss of appetite, dehydration, fever. Sometimes we might see blood or pus in the stool, and over time weight loss can occur, and because of the toxins, intestinal perforation, which is a serious complication. So why do some people develop C. diff? Well, first of all, these are a lot of the risk factors that put people at risk for developing C. diff. Long-term antibiotic use or multiple antibiotics. And we saw that with our patient just now with Mr. Warner. He was on amoxicillin, he was on levofloxacin. Anyone who's had surgery of the GI tract. Any type of diseases of the colon, such as inflammatory bowel disease or colorectal cancer. So he also had that risk factor. A weakened immune system. He had that risk factor, and a use of chemotherapy drugs, which he had that risk factor. Anyone who had a previous C. diff infection, advanced age, anybody 65 years or older, kidney disease, or any use of drugs called protein pump inhibitors, which lessen stomach acid. How can we make that diagnosis? The first thing we do is when we suspect somebody having C. diff, we'll send down a stool specimen, or also it can be diagnosed by a colonoscopy. Treatment is a 10 to 14 day course of Flagyl or vancomycin or probiotics, and of course avoiding dehydration by providing lots of fluids to the patient as well. So how can we prevent C. diff? Washing our hands with soap and water frequently, not to rely just on alcohol-based hand sanitizers, cleaning surfaces in bathrooms and kitchens regularly with chlorine bleach-based products, washing soiled clothes with detergent and chlorine bleach, and not using antibiotics unless a doctor recommends them. So every time you get sick, it's not necessary that we put everybody on an antibiotic, because a lot of these illnesses we unfortunately get are caused by viruses in which our antibiotics will not help them. All right, so that's a little bit about C. diff. Okay, what I want to do is read you a little bit more information about this article that I found regarding C. diff, and it really brings to light a lot of information that I was not even aware of. So let me go over this with you. C. diff is a well-recognized causative agent of healthcare-associated infectious diarrhea. The incidence and severity of CDIs are increasing, as documented by outbreaks of particularly virulent and drug-resistant strains. When someone develops a C. diff, it often leads to prolonged hospitalization and significant financial burden. And so in an effort to curb these disturbing trends and the enormous burden of disease, the Joint Commission identified the implementation of evidence-based practices to prevent multi-drug resistant organism infections as a 2011 national patient safety goal. Nurses are critical to the successful implementation of this goal and to the proper management and care of patients with CDIs. So what is C. diff? C. diff is an anaerobic gram-positive bacterium that produces spores resistant to heat, drying, and many antiseptic solutions. I didn't even know this, but they are viable outside the gut for 5 months or longer. C. diff is transmitted from person to person by the fecal-oral route. The virulence of the bacteria and spore resilience makes CDI one of the most contagious diseases in healthcare facilities. And what we see, according to the Society for Healthcare Epidemiology of America and the Infectious Diseases Society of America, define the typical case presentation of C. diff as follows. The presence of diarrhea, defined as passage of 3 or more unformed stools in a 24-hour or fewer consecutive hours, and a stool test results positive from the presence of toxigenic C. difficile or its toxins, or colonoscopic and histopathologic findings demonstrating pseudomembranous colitis. A CDI usually occurs in the presence of ongoing or recent antibiotic therapy or chemotherapy, and that's probably one of the 2 common reasons why we see people unfortunately get C. diff. C. diff symptoms typically present within 1 to 2 weeks of antibiotic or chemotherapy exposure, but may present as early as 1 day post-exposure to as late as 3 months post-exposure. And what happens is a patient with C. diff experiences a proliferation of C. diff, and proliferation means that the bacteria continues to grow and grow and grow in the large intestine, which produces toxins A and B, leading to gut inflammation, fluid and mucus secretion, and colitis. A person with a severe case may also develop a fever, abdominal discomfort, and leukocytosis, meaning that their white count is elevated. It can range anywhere from mild diarrhea to a fulminant colitis, toxic megacolon, and even death. Management depends on symptom severity, and it's important to note that some individuals are asymptomatic carriers of C. diff, which does not warrant routine screening or treatment. And here's something that was in this article that was in italics, and I want to just read this little short paragraph to you. C. diff is more than just another infection that requires gown, gloves, and hand washing, because when our patients are having C. diff, they do require contact precautions to be initiated. It is an illness that can be life-threatening under certain circumstances. The consequences of untreated C. diff can include sepsis, warranting transfer to the ICU, toxic megacolon, colectomy, and sometimes death. People often underestimate the potential dangers of C. diff. I think that's very important to make sure that I get that across to you. The article goes on to talk about what are the signs and symptoms of C. diff, and usually diarrhea is probably one of the most frequent presentations of the disease. How is it managed? When caring for a patient with confirmed CDI, nurses should employ the same protocols as they would when caring for a patient with any GI disease, a contagious illness, and diarrhea. It talks about the treatment. Usually Flagyl is the first-line medication for a mild to moderate CDI, but if the patient suffers from a severe complicated disease, the provider may bypass Flagyl and treat with vancomycin or a combination of the 2. Oral pharmacological therapy is the preferred route of administration, as evidence of efficacy of intravenous antibiotic treatment for a CD is limited. Anti-motility agents, including narcotics, should not be used. As many as 25% to 35% of patients will experience recurrent CDIs. Evidence of the best treatment for recurrent CDIs is limited. Many experts believe patients with recurrent CDIs will respond to another round of antibiotic therapy, although this practice may ultimately lead to people developing antibiotic resistance. Other clients support a fecal bacterial therapy, which is stool transplant from a healthy donor into the GI tract of a patient, as an an alternate to antibiotic therapy. So we're not really sure if that's the best way, but they're looking into that and doing more research with that. Can it be prevented? And I think this first line of this paragraph is very important, where it says that nurses play a critical role in preventing C. difficile transmissions. Spores are transmitted from patient to patient via improperly sanitized hands and also through the use of contaminated shared equipment. Meticulous hand hygiene using soap and water and strict adherence to isolation protocols are therefore the foundation for elective C. diff transmission prevention. Hand washing and strict isolation should be observed when caring for patients even after the resolution of CDI syndrome, as they are still capable of shedding spores long after clinical symptoms subside. It is important for nurses to communicate with their institutional epidemiology staff to determine appropriate duration of isolation for the patient with a concurrent or prior history of C. diff on a case-by-case basis. So what should the families and what should the patients be taught about C. diff? All patients infected or colonized with C. diff must be educated about this bacterium, proper disease management. The Joint Commission recommends using the teach back and show back method to educate patients, that is, ask the patient to teach back the information provided or demonstrate understanding by showing a skill such as hand washing or proper donning of isolation equipment. Especially when the patient's families come in, we want to make sure that they're completely adhering to isolation precautions. So, risk factors. Obviously, recent antibiotic exposure, particularly things like clindamycin, cephalosporins, and fluoroquinolones. And we said that before. Recent chemo exposure, protein pump inhibitor exposure, and even patients that are on prolonged tube feedings. Medical factors are neutropenia, which our patient Mr. Warner had, and that's just a fancy term for a low white blood cell count. Immunosuppression, history of CDIs, GI comorbidity, critically ill patients, and recent surgery. So, recent exposure to healthcare facility, particularly a prolonged exposure as in an inpatient or long-term care facility. And these are the environmental factors, or recent cohabitation with a patient diagnosed with C. diff. And other factors, as we said on the PowerPoint, is advanced age and even a non-newborn hospitalized infant that's less than 1 year old. So some of the severe complications that we see is hypotension. They can develop a paralytic ileus, toxic megacolon perforation, the need for a colectomy, or even an ICU admission for severe disease. And then, of course, we talked about the treatment with Flagyl. And then we can either give that oral, unless the patient's unable to tolerate anything orally, and then vancomycin. And then key points is to bring up to you is that C. diff is an increasingly common and virulent microorganism. CDI incidence is rising and starting to affect populations previously considered low risk. Nurses need to integrate CDI knowledge and assessment skills into their practice to combat the international epidemic of multi-drug resistant organisms. So I wanted to share that with you. I think that's some additional extremely important information that I wanted you to kind of hear. All right. All right. Lastly, what we're going to do is do a question and answer on the concept of infection. Okay, question 1. The nurse is caring for a patient admitted with newly diagnosed tuberculosis or TB secondary to AIDS. What priority action should the nurse take? And number 1, institute airborne precautions. Number 2, assess for other fungal infections. Number 3, assess CD4 plus counts and viral load. Number 4, teach cough and deep breathing. Well, this I don't think it's too hard of a question. And the answer I'm sure you all got was to institute airborne precautions. Let's read about that rationale that goes along with that answer. Active TB can be transmitted by airborne droplets and can affect other individuals who come in close contact with the client. Therefore, the priority action by the nurse is to institute airborne precautions. The nurse should also perform the other nursing actions, but these interventions are not the priority nursing action in this scenario. All right, so question 2, and here we go. The client admitted for pneumonia asks the nurse why a sputum sample is needed. Which response by the nurse is most accurate? Number 1, a total of 3 sputum samples will be collected. Number 2, the results from the test will help rule out atelectasis. Number 3, coughing up sputum will expectorate the secretions. Number 4, the results will help with determining the antibiotic treatment. Think about it, and the answer is, sure, you got this one right as well. The results will help with determining the antibiotic treatment. Great job, everybody. All right, that concludes those couple questions on isolation. Please, I'd like to definitely be sure that you guys have watched the isolation technique video in Canvas, and I'm also going to have you watch the MRSA video as well. Those links will be available in your Canvas course, and you need to view those on your own. All right, let me know if you have any questions concerning the information on those. Thank you so much for your attention, and it's always good to talk with you in our WebEx virtual chats. So looking forward to that in the upcoming week. Have a great day.